Here is your question.
I will wash my hand. My name is.
Few seconds are left. I'll give you one. I normally give 1 minute to read the question. So bell will go, you'll give the bell. Then you can start. Right. So if you have read and understood, considering the clinical examination station, kindly begin.
Yes. I will wash my hands.
Yes.
And my name is Dr. Howard. I am a surgical doctor in this hospital. May I ask your name and age, please?
I'm Tom, 66 years old.
Okay, Tom, today I want to examine your hip joint by seeing and walking. Is it okay for you?
Yes.
Do you have any pain?
Yes, little.
Do you want any painkiller tablet?
No,
or
that's
we can
all
continue?
Right. You can
continue. Okay. Okay, Tom, you will stand in the room and I will expose you with the dignity. You will be under garment and I will check with it.
Okay.
So first of all, on inspection look, I will check any scar, any muscle wasting anteriorly, laterally, and posteriorly, the scars mark and gluteus maximus wasting, and the posture of the patient. Is there any pelvic tilting or not? Then can you walk to this door?
Okay.
And I will check your walking.
Yes.
And okay, that's good. It looks okay. Then please, can you lie on the bed?
Okay.
Okay, then I will feel the joint by palpating the greater trochanter hip joint, feel the temperature and both joints. And then I will check any tenderness in the joint, pain is there or not. And then I will compress the joint. Then I will ask the Tom, please flex both joints, hip joints to your abdomen. Can you flex it? Then Tom can do it or not. I will check it. Then after
you'll
that,
show how flexion is. Patient does not know what flexion is. So you'll ask, can you just follow the actions like I'm doing?
Tom, touch your knee joint to your tummy, both knee joint. And Tom will do it. Then after that, I will ask the Tom to raise his both legs, and in this he has done. Then I will do the active movement of the hip joint, and I will do the internal rotation. I will show him how I will do the, first of all, I will do the apparent leg lengthening and the actual true leg lengthening by umbilicus to the medial malleolus, and then the anterior superior spine to medial malleolus of the both lower limbs. After that, I will do the internal rotation while the knee joint is flexed, and I will do the internal and external rotation. I will do the manual in this way. Then I will, while the knee joint and hip joint and flex, then I will do the in extension. Both legs of the Tom is in extended position. Tom, you will keep your foot outward. Then I will check his external rotation, and then foot inward, Tom. Then I will check the internal rotation. After that, I will check, Tom, can you keep your leg out of the bed? And then I will do the inside of the midline of the body, that is adduction and abduction will be checked. And then I will do the flexion of the hip joint by myself, that we can occur or not. And then I also check the distance between his hip and the foot, how much the distance. And after that, I will ask the Tom to prone, and I will ask him to lift his thigh, respectively right and left. Then I will do myself this posture, and then I will ask the Tom to stand on one joint, and then I will check that Tom leg is pelvis is tilted on which side. Is it okay or it is tilting? Now, Tom, I have completed my examination. Thank you very much. I will wash my hand.
Have you done all the special tests?
Just one Thomas test I will do, that I will place my hand behind the back of the patient and ask.
Another test you also have to do.
Yes, I will do the straight leg raising test and then flex the foot. Then it can cause pain or not. That is, these two tests I will do it.
And leg length discrepancy, how would you measure that?
I will measure by umbilicus to the medial malleolus of both legs, and then anterior superior spine to the medial malleolus of both legs. Then I will know it is normal or it is increased or decreased.
Okay, right.
These are the tests.
Yes. 10 seconds are left. Okay, if time would have allowed you, how would you have completed your examination?
I will complete my examination by the spine examination and the knee joint examination.
And complete
X-ray
neurovascular examination of the lower limb.
Yes.
Okay, can you please present your examination?
I examined this 66-year-old man, Tom, with the pain in the right hip joint for the last 4 weeks, and this pain is increased on walking. And I examined this patient, and my suspected diagnosis is the osteoarthritis. Maybe patient has fracture, and maybe it is due to rheumatoid arthritis, and maybe less likely any trauma he had got.
How would you confirm your diagnosis?
I will do the X-ray of the hip joint, and then I will proceed. And lab test, basic lab test, I will do blood CP and calcium, serum calcium level, vitamin D level, C-reactive protein. But main test is X-ray of the hip joint.
What are the management alternatives that can be offered to the patient?
I can treat this patient conservatively, as well as according to X-ray and CT scan finding. I will proceed to, first of all, I will give painkillers, physiotherapy, painkiller gel, and life modification. Weight is increased, then should be reduced. And other thing is that according to X-ray, CT scan finding, patient can go in this age, patient can go in joint replacement or hemiarthroplasty. It depends on the condition of the joint and orthopedic opinion. I will also involve the physiotherapist in this case, if it is not a non-operative case.
Okay, why not involve the occupational therapist? Why physiotherapist? What is the difference?
Because
between please.
Physiotherapist, in this case, patient did not mention his occupation, so I involve physiotherapist.
Okay, but what is the difference in between physiotherapist and occupational therapist?
Occupational therapist, if the patient is working, then the occupational therapist give idea how to work, how to sit, and which type of bed will be used. And physiotherapist is and how to work in the working environment, what the walking aids and anything should be. In this case, I must also check the walking aids and anything during examination. And physiotherapist will only do the physiotherapy and instruction.
if patient does not respond to your conservative management, what other advanced or invasive management can you offer to the patient?
Patient can go operation treatment in which I can do the hemiarthroplasty. In this case, if it is
before
case
that, you can offer steroid injections, and then you can ask, it doesn't respond, then you can go for that. Okay, good, thank you. Just little comment that for this patient, I would recommend that once you're doing inspection and palpation, and then Trendelenburg examination while patient is standing. And once all these three are done, then you can ask the patient to lie down and do the rest while lying down. Because if you are doing standing and then ask the patient to lie down and then ask again to stand up so that you could do this will probably make patient little uncomfortable. So, but it doesn't matter, you can do it in any order. It's just my opinion.
Madam, palpation, I did the palpation on lying position. So before patient is lie down, it is better. I'm also comfortable if I do the Trendelenburg test during inspection. So it is no problem. I can do during inspection after gate checking. I will do the Trendelenburg test. It is easy for me.
Right. Yes. Good. Thank you.